dietary fiber is mainly used to treat constipation, to treat diabetes mellitus, and to reduce the blood cholesterol level in hypercholesterolemia patients, and to reduce the incidence of cancer colon. Now, in constipation, what happens is the frequency of passage of stool is reduced. So, when dietary fiber is taken, what happens is it absorbs water, meaning dietary fiber will be coated with water. On outside, it will be having a lot of water, that is called absorption of water. This increases the bulk of feces, and also remember dietary fiber is indigestible, so that itself will add to the bulk of feces. Because of the increase in the bulk of feces, it stimulates intestinal peristalsis so that the feces is evacuated. So in constipation, the frequency is less. So once a person takes dietary fiber, the passage of stool frequency will increase. In diabetes mellitus, how it helps is, see, in diabetes mellitus, glucose is absorbed more and more, right? So now, if dietary fiber is taken, it will act like a barrier. So this blue line indicates dietary fiber. Just for representative purpose, it is shown like this. This blue line is a dietary fiber. So now there is a glucose, or the digested food particles are present in the intestinal lumen. This is the cut section of intestinal lumen. These are enterocytes through which the glucose has to be absorbed. So now dietary fiber will act like a barrier between the glucose and reduces the absorption. So it forms a dietary fiber forms a mechanical barrier and prevents the absorption of glucose from the intestine. So that is how it tries to reduce the blood glucose level in diabetes mellitus. In hypercholesterolemia patients, cholesterol level is very high, right? We all know cholesterol will be converted or utilized to form bile salts. Now, if there is a dietary fiber in your intestine, what happens is dietary fiber will absorb all the bile salts, and when dietary fiber is lost in the stool, bile salt is also lost. So it interrupts the enterohepatic circulation. Normally, bile salts undergoes enterohepatic circulation. All the bile salts will be absorbed into liver and it will be reutilized again. Okay, so now since the bile is lost, the bile salt is lost in the stool, what happens is the liver will convert the blood cholesterol. More and more cholesterol is converted into bile salt, and that will be indirectly lost. So indirectly it reduces the cholesterol level in the blood by increasing the utilization of cholesterol for the production of bile salts. Now coming on to how it reduces the incidence of cancer colon. Now remember, there are some toxins or carcinogens what we take in our food, that is what causes your cancer colon, right? Now when you take dietary fiber, what happens is this carcinogens or toxins will bind with the dietary fiber and it will be lost in the stool. Or it also reduces the transit time. Transit time meaning the amount of time the food or the carcinogen stays in the lumen of the intestine. For example, imagine if a patient has constipation, transit time is very high. If a patient has diarrhea, the transit time is less. So now when you add dietary fiber to your food, the bulk of the stool increases, so the peristalsis increases, right? So this reduces the transit time. So the fecal matter along with the carcinogens in them will not be present in the large intestine for a longer time, so it will be easily lost in the stool. And also remember, as I told, your dietary fiber absorbs a lot of water, right? So there is a chance of dilution of carcinogens by the water which is held by the dietary fiber. So these are the three proposed mechanisms for reducing the CA colon by the use of dietary fiber. So just to summarize, dietary fiber is used in constipation because it stimulates the intestinal peristalsis. In diabetes mellitus, dietary fiber acts like a barrier and prevents the absorption of glucose. In hypercholesterolemia patient, what happens is the cholesterol is utilized to convert into bile salts because bile salts will be lost along with the dietary fiber. In CA colon, the carcinogens gets diluted by the water. At the same time, it binds with the dietary fiber and it will be easily lost in the stool.